Today, Tim, you and I are going to talk about 7 fundamentals of competence compliance. Now, when you and I first started talking about this, you and I really were contemplating how do we present HIPAA, because we could present HIPAA from a negative standpoint, or we can present it from a positive standpoint. You want to kind of share a little bit about your thoughts about that?
Yeah, most of the time when you operate your business, there's a legitimate standard of concern in regards to the fact when you're interacting with the government and they have all these coercive compliance powers that they can do and they can use on you. The opposite of that is understanding what it is they're looking for and how that you can confidently be compliant with that and build that compliance into your structure. And it has 2 great benefits. One is it eliminates the fear, and 2, it puts you within the structure of having very purposeful compliance. And so you have a very confident staff and operation in terms of how you function.
So where does all of this come from? The 7 fundamentals that Tim and I are going to be discussing is not 7 fundamentals that I've made up or Tim has made up. These are 7 fundamental elements that have been created by HHS and the Office of the OIG group, the attorneys there. They have declared that these elements that are described in Chapter 8, again, nobody's going to have to remember any of this information, but just kind of give me the information. Chapter 8 of the United States Sentencing Commission Guidelines Manual are the 7 fundamental elements of an effective compliance program. So let's take a look at what those are. Here are the 7. Number 1, you need to implement a written policy, procedures, and standards of conduct. We're going to go through each one of these here in a moment just to make sure that we get all of this particular things covered. 2, designating a compliance officer and compliance committee. Number 3, conducting effective training and education. 4, developing effective lines of communication. Number 5, conducting internal monitoring and auditing. Now, those are going to be 2 separate things that we're going to talk about within number 5. Number 6 is enforcing standards through well-publicized disciplinary guidelines. And then lastly, 7, responding promptly to detected offenses and undertaking corrective actions. I see we've got a question that's come in, and we're going to get to that one here in just a minute. But one of the things that we're going to share with you here, and we'll share with you at the end of the webinar, is how do I know that I'm hitting all 7 of these? Well, we do have a HIPAA compliance checklist that if you would like to, we're going to send you this information very shortly after the webinar so that you'll have it. You can kind of work with this through with your group of people there in your office. So everybody on the webinar today is going to actually get a copy of this. So Tim, let's start with number 1. Number 1, the first element is implementing written policies, procedures, and standards of conduct. Just in general, because you've owned a lot of businesses, you've helped a lot of businesses get going. Tell me the importance of just having, in general, standards of conduct.
Well, this particular part of the policy is vital because it does 2 primary things. One, it establishes the code of conduct across the board for everybody, and it is the same. That is the second value to it, is that it doesn't fluctuate. And so it establishes it, everybody knows what it is, and it's the same. It permeates the organization if we are consistent with the policies that we write out. And that allows everybody to function within a framework that they understand, and it will allow them to recognize when there's a deviation from the standard.
You bet. And again, I mean, we would almost think this is something that is would come natural in most businesses, but you have found out that this is not a normal thing in many businesses, whether we're dealing with healthcare or not.
That's correct. I'm presently dealing with 4 practices, and the written policies, procedures, and standards at this point have not been completed
Yeah.
in any of them.
Yeah, in any of them. So, folks, what needs to go in these are these documents memorializing the healthcare's practice expectations with regards to compliance. So, again, whether you are, let's just kind of take it, because I think we've got people from all different backgrounds here. So, whether you are a billing company, whether you are a private practice, whether you are a practice within a large group, whether you are a hospital, a clinic, these documents need to be at every location and make sure that everybody understands what those written policies are, what those procedures are, and what those standards of conduct are going to be. Further, they explain the practice's commitment to the legal standards, the ethical conduct, and the quality of care that's going to need to happen. So, what should be included in that? So, Tim, what I've done here is just taken a couple of little things that we will work with practices with to make sure that that information's in there. So again, your organization missions, values, expectations, and guidelines, principles for your workplace behavior should, number one, a code of conduct which identifies model behavior for employees. Again, Tim, you would think this is standard with just businesses in general.
Well, you would, except it's not. It's like one of those assumptions that we make. We assume that we know, and therefore, because we make those assumptions, we don't follow through.
That's it.
And this happens within the workplace consistently.
Yeah, so again, we could apply this across the board with many different businesses, but this is a requirement that every office, every clinic, every hospital, whether you're a dentist office, whether you are, again, a billing company, these things need to be implemented and have. And the second one explains how to report suspected instances of compliant violations and unethical activity. Just in general, let's kind of talk real quickly what unethical activity may be.
So remember that the problem with the Alabama case was accessing a record and sharing it with a third party.
Yes. Yeah, and you know what? I think we've got to be careful. I think this is one of the things that all offices just need to be thinking about. If you're having a team meeting of any sort, and let's say that you're talking about a particular patient, it cannot be within earshot either of potential people who either A, are other patients, or B, your vendors. So you got to be careful about that as you're holding meetings and what you're talking about this your patient health information. There's a lot of things there. That protected health information is extremely important. So again, we're talking about just right now the written policies. Tim, here is a question. Let's kind of jump on this one before it gets too late, and we want to make sure we get some of the questions here. Question has come in. Our EHR, our electronic health records company, says that they are HIPAA compliant. How do I know that?
Well, that is a good question. One, their representation that they make to you should be in writing. Number two, what is their insurance backups for that? And then there's also the possibility of having an outside entity grant them after investigation a seal of compliance.
Yes.
And so those are some good markers right there.
And you said something great right there at the end. I mean, we always kind of talk about our vendors and our EHR companies, our practice management companies, our software companies, that they have some type of seal of compliance. We can help provide a seal of compliance that is recognizable in the HIPAA world for each person that's on here today. So if there's a specific thing that you want us to help you with, we can actually help you achieve that and have some type of your own seal of approval that you can have there for your vendors and for your patients to actually kind of get recognized. Moving on, let's talk about element number 2, designating a compliancy officer and a compliancy committee.
Well, with the compliancy officer, it would be vital for a well-trained staff to know exactly who the point of contact is,
Yeah.
where they can either transfer information or obtain information when questions are presented.
Yeah. So you need to have either a compliancy officer or a compliance committee, and what those assigned duties to those respective roles are. That compliancy officer should be very familiar with the practices, operationals, and compliancy activities. This point is crucial because that compliancy officer without a delegated authority will not likely be very effective. There is a question that may pop up as we kind of go through this. So if you got a specific question about a compliancy officer, again, this is a great time to maybe ask that question. So what are the expectations of a compliancy officer and a compliancy committee? Well, that compliancy officer should be, again, very familiar with that practices, operationals, and compliancy activities. This point is crucial because, again, without that, they're not going to be effective. So these four things: they need to have an understanding and administrating of that compliancy program. 2, they must be informed about the outcomes of audits and monitoring. And again, we're going to kind of talk about that here in just a moment. Reporting on compliancy enforcement activities, and then 4, assessing and reviewing the compliancy program. Tim, I can already tell you that I know that some doctors' offices will say, yeah, I can probably go to my library back over here and pull out a compliancy document, or I've got a compliancy manual. Let's first talk about that, and then there's a question that's come in I want to help get answered here. But is having just a manual in the library somewhere good enough?
Well, no. Having the book there and the book never getting read or implemented or discussed is actually going to be a negative for the business. So in order to turn it into a positive, you got to have a person who is designated, who understands what it is, and who can create a culture that is consistent within the practice that takes a tremendous amount of confidence in implementing what the policies and procedures are. They not only will help in terms of the policies and procedures, but their confident knowledge of that and their confident teaching of that to other staff members will have a tremendous impact within the culture of the office and the practice itself, because confidence will breed confidence.
You bet. That's awesome. Here's a question that has perked up here, Tim. Our office does not have an official compliancy officer. Does that mean that the office manager is just the official compliancy officer?
Well, typically, that is a position that's created by default. That's not a good way to do it. It needs to be done by intentionality, so that that person is fully aware of, their responsibilities, their accountabilities, and their authorities. And every person within the staff and the operation is also aware of it. And so if it's the office manager, that's fine, but it needs to be officially done.
Yeah, and if you're on here right today, I mean, we don't want to, we set out this whole webinar not to strike fear, but again, to bring awareness. So if you go back to your place where you may be listening from your office today, and you're going, wow, these are some questions I never even thought of. Really, who is our compliancy officer? Do we have this documentation? You're not in a position of panic right now. Tim, you kind of mentioned it. You and I were discussing some of this, and we'll keep on going with some of these questions here in just a moment. But I know that not everybody can stay the full hour, so I want to kind of address some of these high-ended, frequently asked questions here. But just present this question to you. If we're already starting to see some potential holes in our compliancy, what should somebody be doing already? What should they do? How can they address this with not, run into the doctor or their director and going, oh my gosh, the house is on fire? Well,
the first thing is to make sure that you correctly identify what the problem is. And every problem then presents itself as a possibility for us to implement a very positive solution, and then to educate a culture that systematically understands and implements that positive policy procedure. So it's a great opportunity to recognize a weakness and implement a positive answer.
I think you said it well. I mean, we all need to kind of go through our self-examination sometimes. We always need to find out what our strengths and what our weaknesses are. And that's all this is doing, just from a compliancy issue. That's what it is. And hopefully that's the awareness that we're bringing to the table today. Number 3 on the 7 fundamentals. And again, remember, these fundamental elements are coming from the government, not from Tim and Eric, but these are the things that need to be taken care of. The third one is conducting effective training and education. And I can probably already think about some of the questions that might be coming up about this, is how often do we need to do training? Hopefully we'll be able to answer some of that. But the third element of this compliance plan is training and education to ensure adequate understanding of the expectations set forth in your compliance plan and code of conduct. Remember that this training needs to be very comprehensive review of that manual that you may have in your library. Like Tim and I have already mentioned, just having that there in your office is not good enough. Matter of fact, it can actually present a bigger problem, because if you have someone from the Office of Civil Rights come in, or you get reported by a patient that they think that there's something going on, and then someone from that organization comes in and they go, first of all, who is your compliancy officer? Where's your compliancy manual? And where are your elements of training that you've been able to show? And if you can just point to a manual, that's not going to be good enough for you. So this initial training should be that comprehensive review that everybody should understand, and continue training on an annual basis and with every new hire that you get. Tim, you and I both know in doctors' offices, in clinics, there can be some high turnover. Let's talk real quickly about getting those new hires trained.
Well, this is where with today's technology, one of the great things is that you can systematize this, you can track this, and you know exactly when people are due for new education, for renewed education, and for a new hire. It's a simple process to systematize that into the orientation. And so we can deal with this very confidently in terms of converting our manual over into consistent education for new hires and annual training for our staff.
Yeah, there you go. All right, so real quickly, some of the elements that need to be dealt with in training. It's all about retention. Tim and I, you and I have been to enough trainings that sometimes we go to those trainings. They're almost kind of like rah-rah sessions. We go, wow, that was really energetic, but we walk away, we have no clue of what we learned. So it's kind of like, just keep it simple. The whole KISS scenario, keep it simple, but make sure that there's retention as you bring on those new hires, you train, you bring those folks to retention. So we're just telling you real quickly about some of these elements. And remember, at the end of today, I'm going to be sending out, not only we'll have a recording of this and you can kind of go back and watch later, but we will have a PDF of the slides that you can kind of review yourself and just have some of your own notes. But again here, educate your employees about the importance of reporting issues in a timely manner. Tim, this will probably get somebody in trouble quicker than anything else. It's one thing when you have a breach, it's how quickly you take care of it.
Yes, and this is also why it is important to have a procedure in place and that people understand it, because if in our training we can sell the concept of being honorable and dealing with integrity with our information related to patients, it's much easier for people to move forward knowing that they're doing so in a spirit of honor and integrity than it is in a spirit of fear.
Yeah, absolutely. And then lastly here on this training, now this is probably the most precarious part of the training, and that is what happens if one of your employees does a breach and then one of your other employees feel like they need to report that. I bet you there's nobody on the call today that hasn't been somewhat in their lifetime underneath this type of scenario. So you need to, if you are in charge of compliancy, you need to make sure if you're the compliancy officer or you're on that committee, you need to have, like I said down here at the last part, a very well promoted open door policy, which means that the person that's going to report this information doesn't feel like they themselves are in fear of losing their own jobs. Now, we talked about disciplinary issues whenever there are breaches. Obviously, if you've got a very blatant issue, like I mentioned earlier, you're going to have to deal with that. And that's a compliance issue that, again, that people need to make sure that there's an open door policy. All right, so we're about halfway through. We're kind of got about 25 more minutes that we've got here on the webinar, but let's try to get through the fourth element. And that is developing, again, effective lines of communication, which kind of, what I just said, kind of leads us right into this, that again, employees should have several ways to report compliance and ethical concerns. And Tim, hopefully everybody can see that one of the overall themes of what we're talking about compliancy is this word ethical concerns or ethics in general. Tim, I know that outside of business, you deal a lot with ethics, business ethics, personal ethics. Here we're dealing with healthcare ethics. You want to share a little bit about that?
Yeah, I think one of the things that's really vital within structure of an organization, a business, is that there's a concept that's known as lean. And lean is a concept that has to do with delegating the solving of problems to its closest point of responsibility. And the thing that has improved so much with that is that the individual employees are empowered to bring forth solutions, and they are aware that those solutions will be evaluated within a team context and implemented. So if you have within your office a group of people who understand that they can bring forth suggestions and methods for reporting what they're comfortable with, what they're not comfortable with, those kinds of things, and that they're going to be listened to and implemented, what's going to happen, you're going to get total buy-in, and everybody will participate with that because they know they have a voice. Yeah. It's a great way to create an environment that we really are a team.
You bet. And again, that's what we're showing here. Are your employees familiar with compliance and ethical issues and how they should report them? Are your employees, again, your team, your nurses, your doctors themselves? I mean, we've really got to understand that we've got to deal with the doctors. And then are employees aware of specific timeframes for their reporting of those compliances and of those ethical issues? So again, we've got all of this happening all together. Number 5 here, conducting internal monitoring and auditing. Now, this is one of those responsibilities of guess who? The compliancy officer and possibly that compliancy committee, because you can do your own self-monitoring and auditing. However, you can have a third-party monitoring group and auditing group there as well. So we're going to talk about that here real briefly. Tim, before we get to this, I want to grab one of those other questions that kind of came up is, can we use Gmail for our doctor's office? And what about scheduling patients with a Google account? What is our knowledge on that?
Well, I actually had a write-up on that, and there is a way to use a Gmail account. It has to be the paid-for service.
Yep.
So that can be done, and I don't have my paperwork right here in front of me, and I'm hoping that you have it so that you could expand on that a little bit, because
yeah, I do. I've got it here with me. It says as of September of 2013, the answer is yes, and you're correct that there is a HIPAA compliant Gmail account, but it's a paid version of it. So you can't just use the free Gmail account, or let's say Yahoo or Hotmail or whatever else that you're doing. There are some specific ways that you have to communicate that PHI, and it has to be specifically HIPAA compliant, which again, if your organization is using even a free service to do your scheduling, again, you got to make sure that that's not the free one, because again, remember, you could put the patient's name and then maybe why they're coming in on that calendar, and that's open up to everybody. And again, you've got some issues there. And that's why we want to talk about the internal monitoring and the auditing, because this kind of goes hand in hand with that. So in your effective compliance program, when you're creating your system for monitoring, it's got to comply with everything that we've talked about so far. Remember, if you see an issue, it's your responsibility to deal with it. But again, ignorance is not bliss either. And so that's why, sometimes you might be thinking about having a third-party group that can come in and help you out with, again, both of these. So monitoring, what is this doing? So it's just monitoring, it's gauging whether your things are working as you wanted them intended. You're monitoring recommendations and your corrective actions plans to ensure that they have been implemented. And monitoring occurs on a regular basis, such as weekly and or monthly. Again, folks, the last thing to be thinking about HIPAA is whenever you got a HIPAA breach. Those that are proactive, I love working with proactive people because they're thinking ahead, and they're the ones that are going to really help out, and you're going to have at least a foundation to kind of work from. Then you've got auditing. Auditing is the part where you've got comprehensive reviews, and they require more than just the monitoring, more effort than that, because that auditing is going to ensure your compliancy statutory and with CMS requirements, which includes routine evaluations of that compliancy program to determine whether your program's overall effectiveness is actually in effect. So again, you need to monitor kind of weekly, monthly, however you want to do that on a pretty consistent basis. But then that auditing goes deeper than just kind of just seeing, making sure that everything's there. Any last things here, Tim, that you want to add to this part of it?
Yeah, actually, Eric, this is a tremendous way to enhance two parts of the staff for a practice or a clinic. One is that by a committee and having each person participate, number one, you can delegate responsibilities so every person has a chance to participate in the auditing and the monitoring. This gives them a sense of belonging. It also creates a sense of maturity. And the other thing that this type of a process will do within your office environment is that it will make you more selective in bringing other people in, because you will want people who are willing to accept maturity and work within the structure that it already exists with those two items, honor and integrity.
Yeah.
And so it has a tremendous opportunity to be used as an enhancement tool within the structure of the practice itself.
You bet. Great question. When we're dealing with monitoring, auditing, question just came in, Tim. We've already talked about communicating PHI information via Gmail or emails right there. You can do emails as long as, again, it falls within that HIPAA compliance. You're paying for that, and you get this seal of approval that you know that is HIPAA compliant, because what it's going to have is an audit trail. That's the big thing. The second thing that just came in is, can we use a fax machine for PHI? And the answer is yes, but it has to be the old-fashioned fax machines. And then if you're using that old-fashioned fax machine, if that fax does come in, you got to pull that information off of there. But also, on the flip side of it, if you're sending PHI, you got to make sure that you're sending it the correct phone number, because what if you send that to somebody who doesn't even have, you're not even sending it to your billing company or a doctor or a referring doctor, and you're sending that information to the wrong place. You can't go retrieve that. So what we suggest is that there are faxing softwares, what we call software as a service, that is HIPAA compliant, that has an audit trail. So as we're talking about monitoring and auditing, both your email and your faxes should have some type of audit trail that you can present if in the event that you're ever audited from a HIPAA compliant issue there. So that's just some information that you can kind of tuck away back in the back of your mind whenever you're trying to get information out there. Number 6, Elements, number 6, enforcing standards through well-publicized disciplinary guidelines. Again, folks, nobody likes the word disciplinary, but again, this information is coming from the government. We've got to make sure that we have that. Here it is. This effective compliance program is to ensure consistency and timely discipline when an investigation confirms a violation. We think of the word discipline as a bad thing, Tim, but actually discipline is a good thing because we can all practice good self-discipline. There's the positive side of it. That's what we're really talking about. And that's what the government's looking is, are people practicing a good disciplinary standards of conduct, standards of ethics inside of their healthcare organization?
Well, again, this is another one of those things where it's, when we were raising our children, we would have a thing where we said, if you do this behavior, here is the results, the consequences. If you do this behavior, this is the consequences, and both positive and negative. And so what happens when you do that, and particularly if you have people who are mature in their process, they're confident in what they're doing, then the thing that they appreciate about that is that you have this knowledge, and this knowledge is used to keep you away from danger zones, as it was.
Yeah.
And so you have an appreciation for the fact that it's a protective measure for you. And if you have people who don't intend, where they have bad intent, that disciplinary action protects other people, and it will also help eliminate undesirables.
Yeah, you bet. And folks, if you're in a hiring process and you're bringing new people on, especially let's say that you're a head nurse, these are one of those things that can be very helpful for you as you're doing your interview process. Ask those people from your prior experience, what do they know about HIPAA? What do they know about the disciplinary guidelines? What if they know about this? Because that way, it's actually going to help you hire the top group of people that you're going to need and less worry for yourself. And again, as those new hires are coming in, if you've got these guidelines already set forth and they're there, then you have no problems whenever somebody violates these, because you can always go back and go, we've already talked about this. You agreed to these guidelines to work here. You don't want to put us in jeopardy, the doctor in jeopardy, and our patients in jeopardy. Therefore, these 3 sanctions that we've got, or these 3 items down here, is sanctions for failure to comply with the code of conduct, failure to detect non-compliance through routine observations. And I'm going to expound on that just real briefly. We only have about 15 more minutes. I'm going to keep this short. But folks, let me say this. There are many times, and I think everybody on the call today can think of this. You've gone to the doctor, your regular doctor, you go in to check in, you go sign in. The person that's behind the glass sitting there, guess what they have in front of them? An open chart of another patient. What hinders you or me from getting our phones out and taking a snapshot of that, and that information leaves? I'm not saying that any of us do that, but we recognize the failure of non-compliance through routine observations. If you're an office manager or you are a head nurse or whatever you're doing, or you're running a medical billing company or whatever else that you've got going on, if you see these violations, you have a duty to correct that, or at least say, we can't do those things out in the public. We got to keep that information back where the public can't see it. So again, kind of keep those things through that. Failure to report, the last one, failure to report actual and suspected non-compliance. Again, we're all kind of watching out for each other. These are those guidelines. We're not trying to spy on each other, but again, it's through these routine observations. If we see certain things, correct them, get it to the compliance officer, let them know about it, and let them do that final correction. Lastly, number 7, this is the response time. How quickly do we need to respond when there has been an issue, and what do we need to do about it? So the final element of an effective compliance program is the use of corrective actions when there are vulnerabilities, when there's non-compliance, or when there's potential violations have been identified. So again, let's just kind of talk about this real quickly because we want to kind of start wrapping up and see if there's any more questions that we need to deal with. So again, Tim, prompt response is the key issue here when we're talking about number 7. How often have you seen issues not responded promptly and it has cost the entire organization sometimes the entire business.
The most common factor that brings attention, and once that door is opened, it becomes like a total investigative nightmare.
Yeah.
This issue is the door opener in the vast majority of the cases. So one of the things that we encourage is to have a tremendous joy and a love in protecting the information of the patients.
Yeah.
And if we can approach it from the standpoint of our own honor and our own integrity towards that patient, we will go out of our way to do that and correct it as quickly as possible. And, you know, a response time needs to be immediate.
Yeah, you bet. I'm actually going to put that compliancy checklist right there so you can kind of look at that. So if you've got any questions about that checklist, now's a good time to ask. So last one of the questions that just came in here is this must be from a billing company. They're asking the question, can I take an office laptop home to do billing?
Well, there's actually two answers to that question. Taking one home from the office is probably not a good idea. However, I've just gone through a training course in setting up remote billing. And that is possible to do. So I haven't finished the training yet and gone through the entire process, but I would not suggest taking office computers home.
I think we've got one more question as we kind of wrap up here. Here's a question that, and again, Tim, you and I can kind of discuss here. Are we at least covered if our patients sign the HIPAA release form?
The answer to that would be no. It is helpful. You have to have it. But no, that all the other elements must be included within a proper HIPAA compliance program.
Yeah, you bet. So again, I think that's all the questions that we have for you this afternoon. Hopefully you're able to take away some of this information that we've given you today. We would love to have a conversation with you. If you feel like some of the things that we've talked about today, you feel like, gosh, I don't know if we're hitting all of those things. Obviously, that's part of what we do here at Providence MBA, the whole medical business advancements. We're here to help you make sure that you and your organization is HIPAA compliant. We're doing the same thing with our organization. So we're going through what you might be going through. We're going through it. So we're here to work with you to make sure that your doctor's office, your organization, whether, again, you're a billing company, whether you're an eye clinic, whether you are a hospital, a dentist, whatever you may be, if you're in healthcare and you're seeing patients, we're here to help you with anything that you might find necessary to kind of help you make sure that you are HIPAA compliant. Tim, you got any last minute things you'd like to share with us before we sign off here this afternoon?
No, the biggest thing is that we have one or two choices, and that is that we can approach this subject and build the necessary knowledge that instills confidence and a great appreciation for the purpose for which this law was instituted and this process was instituted, or we can respond out of fear. I think the first one is the better way to go because you gain so much in terms of maturity and appreciation and creating a culture and environment that enhances the care and concern for the patient.
You bet. Folks, remember that, again, we're here to help, whatever we can do to help. We are going to do another webinar next month. Our one on next month, we're going to kind of do that whole thing on ransomware, on the phishing of what's happening with emails. If you get caught with something that has to do with that, we may even have a special guest speaker for us to answer some of those questions. So feel free to kind of be thinking about that. We appreciate you being on the webinar today. It has been our pleasure to kind of give you this information. Please contact us if you feel like you're in a HIPAA breach, you don't know what to do, maybe you don't know who to turn to. We're here to help. We're not here to destroy. We're not going to go run and turn your doctor in or your clinic in. We really want to make sure, as Tim says, we want to be ethical with the information that's given to us. So we want to make sure that we get that to you. We will have this in a recording, so if you'd like to watch it a little bit later or share this recording with somebody else, feel free to do that. Again, we thank you for your time this afternoon. We appreciate you taking a full hour of your time. Many people, when the people that joined us have stayed on for the entire thing. We certainly appreciate that. Tim, I thank you for your time too, sir. You have a good afternoon and a great weekend.